Hey, everybody, welcome back to Path to Abundant Living. Ryan Ruff, your moderator here. But as always, I've got the team from Morrison Nordmann joining me. We've got Matt Nordmann with us today. Scott Morrison kicking his feet up today, enjoying a well deserved vacation. But we've got a phenomenal conversation teed up for you guys today. Really thinking about our audience today. We've got, successful business owners out there that tune into this show, high-ranking executives, and today's conversation is very much geared towards you guys because we've got a true expert joining us from the healthcare benefit and employer benefit space. Lee Lewis joining us on the podcast today, the Chief Strategy Officer and GM of Medical Solutions over at the Health Transformation Alliance, stopping by the podcast today. Lee has advised healthcare strategy for Fortune 10 employers, insurance companies, administrators, medical associations, even the departments of labor and justice. He also has incubated and helped more than 24 health benefit startup companies. But then to take it a step further, Lee actually is a fellow comrade here in the podcasting space. He hosts his own podcast entitled Broken Benefits, where he welcomes on some of the highest ranking officials from some of the biggest companies in our country to talk about how the greater benefits realm, if you will, of healthcare is broken in a way, and decide and talk through solutions and some of the controversies and the issues that keep employers from delivering real value to their employees. So today we're going to have a really holistic conversation surrounding employer benefits and what employers could really be doing to raise the bar a little bit and get back to providing a benefit that is truly valuable to the employee. Before we bring Lee on, let's say hey to Matt. Matt, good to see you this morning. How you doing?
Ryan, great to see you. How are you today?
Good, doing well. Our audience might hear it in me. I'm on the back end of a cold, but feeling a lot better and excited to be with you today. But we got a good one in Lee. I've known Lee personally for a little while now. Just quite a virtuoso in the healthcare space, and we've got a good conversation on tap. Matt, I know you have a lot of conversations with your, business owner clients, and I'm sure, gosh, benefits come up in the conversations because it's a pretty hefty line item on most balance sheets. Anything to kind of set the scene before we bring Leon?
Yeah, so as a business owner ourselves, and as the clients that we work with, the business owners, like you said, it is a big line item, healthcare. And we're not going to get into, deep into, certain aspects of healthcare, but really as an employer, what's happening in this world and how can it be improved? And as a business owner, what should we be thinking about? Right? When we're looking at, other than payroll, it's the biggest line item on the profit and loss statement.
Yeah, and not to mention just with so many options and solutions, companies that exist out there, then throw in technology and AI and how that's crept into the picture. Just a lot to dive into today. So with that being said, let's go ahead and welcome our guest aboard. Lee, great to see you this morning. Thanks so much for joining us on Path to Abundant Living.
Oh, thanks so much for really inviting me. Excited to be here.
Yeah, no, it's great to have you, Lee. HTA, let's start there. Matt, you want to bat lead off?
Yeah, fantastic. Lee, very nice to meet you. Glad you can join us today. Love to hear your insight and expertise. So the Health Transformation Alliance, it represents some of the largest employers in the country. What is the core problem in the healthcare system that you were created to solve, right? There's so many of them, right? But what's the one
Yeah.
that you were created to solve?
Yeah, the fundamental core issue that came up about 10 years ago that caused the CHROs from a couple of the largest companies in the country, they came together and said, look, for every dollar we spend on healthcare, we get 60 cents back. And we have control over all of our other expenses. Like we have a good handle on our supply chain. We have a good handle on marketing and legal. Our manufacturing is in place. We've got a good sense of how we're doing on payroll. Healthcare is like the unrideable bull that is just marching through our operation that nobody can seem to get any control over. And nobody's coming to save us. Congress isn't going to pass anything. Hospitals, our cost is their profit. Insurance companies, our cost is their profit. Consultants and brokers, profit. Like the big cost that we're complaining about is paying everybody else's paychecks.
Knowing that, how do you move forward? Right?
Yeah.
Like you said,
Mm.
for every dollar you get a 60-cent return. And as a business owner, you're like, okay, I gotta cut that because that is untenable in the long term.
100%. And everybody's feeling it. Every family is feeling it. Every business owner is feeling it. The first thing that we advise people is around three dogmas that are commonly believed by business owners that you've got to dispel or you get nowhere. The first is that healthcare costs are fixed. There's not really much you can do about it, right? And this is intuitive. It's like, oh, people are going to get cancer. I can't stop that. They're going to have a skiing accident. I can't stop that. Like costs just happen. People get sick. There's nothing you can do to stem that tide. Uh, that is accurate. Like bad things happen, but those costs are not a fixed expense. The second thing that people incorrectly believe is that saving money on healthcare hurts people. This is probably the most powerful dogma, is that if you believe that the only way to save money is to increase deductibles and push more costs on families who can't afford it, or ration care by like making people wait longer or taking their doctor away, or just making it so you have to wait a long time or that we narrow the access points or things like that. If any of those things are true, that hurts people and that would be harmful. Like, so people don't like to talk about saving money on healthcare. Like, I'm just going to send people to cheap hospitals or something, and we don't want that. And then the third and final is if you believe those things, then the juice is never worth the squeeze. So you advise your own teams directly or tacitly to not try to do anything big in healthcare, to not take any bold action. You end up walking very timidly around this category, and that entrenches you in untenable trend.
So how do you get people, right? Whether it's the CEO, CFO, whatever, who's ever in charge HR to say, okay, recognize these three things and move off of them.
Yeah. Uh, Outlets like this, if more executives hear that message that, hey, healthcare cost, you can absolutely save a ton of money in healthcare while improving your benefits and taking better care of people. And it's not wildly hard or disruptive. If people could believe that, then they might go back to their teams and say, okay, look, I want you to study this out, find solutions, and get things under control. So that's the first thing is you've got to give permission and create an expectation in your organization that trend above the consumer price index is not going to work. Like you can have healthcare trend at or below inflation. And it's like, oh, it's not just one-off companies that got lucky. We're talking enormous, enormous companies. One of the largest gas station chains in the country just went negative $60 million a year on their trend. You can imagine what that did. That's all profit that went to the bottom line while they were improving their healthcare. And that just happened in the 2025 to 2026 years. So these kinds of things are there. About 10% of the companies of the HTA have near flat trend and year over year for 3 or more years. So there's really a lot of opportunity there for somebody who wants to take a step into it.
So with companies of that size, right, 60 million, right? That's a big number for that company. Do you see this possible for companies that say have, 30, 40, 50, 100 employees?
Oh, it's way easier
Really,
if you
tell
have
us
30,
how.
40,
Tell us how it's
50.
way easier.
Yeah, okay. So let's talk about this. So the first thing is if you are fully insured, right? You're just buying an insurance policy for all your people. Uh, there's nothing much that you can do because your people are being pooled with every other employer in your area. And so if you save money, you you save money for the insurance company. Blue Cross saves money or Aetna saves money. but you personally don't. If your people are healthier and happier and lower cost than all the other employers in town, then your payments subsidize them. So we've got to get away from that. Now, if you've got 10 employees, it may be tricky to go what they call self-funded. But once you get up into that 50 employees, 75 plus or employees, you can move to self-funded. So when I say self-funded, that sounds terrifying. You're like, there is no way I am bearing the exposure of some person who has a terrible accident or whatever, right? Like we can't afford that. That's way too much risk. That's not what I'm saying. Self-funded, and the name of it just scares people away. You might call it partial self-funded or level funded. But the idea is we're still fully insured. We're just going to take a really big deductible that the organization will pay. That's all it is. So my people might have a deductible of a couple $1,000s. Cool. And then we as an organization, in order to keep costs reasonable, maybe we'll take a deductible of $50,000 or $35,000. If somebody blasts past, so if I have an employee with like a $2,000 deductible, they're going to be on the hook for the first couple thousand, right? Outside of copays and stuff like that. But then if they have a surgery that costs $25,000, okay, they'll pay the first two. And then the organization, we would pay the next $23,000. And then if they had other care, say they had a couple ER visits or something, that would push them above 50, we would pay cash up to the 50. So we would pay the 48,000 after the two. And then beyond that, that just goes to the insurance company. So am I really self-funded? No, I have a big deductible that the employer contributes to. So what's the advantage of that? There's some huge advantages of that. In that now, if you can keep costs reasonable below that $50,000, and there's a ton of great things that we can do to achieve that, we keep all the savings in that corridor, and then we just buy an insurance policy that kicks in at 50 grand. Not that big of a deal. Like that's an achievable goal. And now you as the employer can start to reap those savings. And a huge thing is you get all the data. You now can see all the claims costs that occur for your population. And when you get control and visibility into those costs, that unlocks so much opportunity for you that you'll never have if you're just buying a policy from United Healthcare.
Lee, I want to let Matt pull this thread because I know he's enjoying this, but I've listened to a few episodes of your podcast, Broken Benefits, and the data conversation is a big one with a lot of the high ranking CHROs that are working at these Fortune 10 companies that come on your podcast. Pull that data thread for a hot second. We'll jump back to the smaller business, but I know that that's a really big part of this is so many organizations just get used to not having access to their data and then being able to make decisions based on that data. Go down that rabbit hole for a hot second.
Yeah. Look, you're a business owner. You know that if you don't have any data or visibility into your suppliers and what they cost, into your staff salaries and where they're at, if you don't know what your rent is on your building, that would be a ludicrous position to be in. Yet healthcare gets a pass. All you know is like, it costs me $6,000 a head or $12,000 a household, whatever, to do this. You very much know those numbers. But the health insurance policy is not the cost of healthcare. That's like saying the cost of a Porsche is not what Geico bills me to insure it. That would be crazy. Geico is not my car, just like health insurance is not the cost of healthcare. Health insurance is just something that sort of is a financial instrument to help us moderate cost, and it's clearly broken. So what you must do is you need to get actual data on what the cost of your suppliers are. Blue Cross, United, Aetna, and Cigna are not your suppliers. Baptist Health, the St. Mercy Health, St. Luke's Health, these hospitals are your suppliers. And the doctors and specialists who live in your cities and towns, those are your suppliers. And that's the supply chain you need to be aware of. You've got to penetrate past that insurance company. And 95% of the mid-market employers are totally blind to their actual supply chain.
It is crazy. We talk about this all the time, right? When you talk with business owners, again, not those top 10 that you work with, but somebody again with 50.
We're leaving them to the side. We're talking
200
small
employees.
business.
Right. And you say, okay, let's look at your healthcare. And there's other ways other than the traditional way. And it is eye-opening, as you say, when you show a business owner, whether it's 6 million or 60 million, whatever the number is, that all of a sudden it's like, wait a minute, that's in our pocket. But wait a minute. So explain to me, right? It's kind of that education of like what you're doing right now, of educating people on there are other ways. Now, do you get pushback, right, when from insurance companies, right? Again, not saying good or bad about them, but
No, you're
good. Who are you getting pushback from when you educate?
Everybody. Nobody wants you to save money on healthcare. We've established that, right? The lobbyists don't want you saving money on healthcare. The hospitals, that's paying for their Bentley. They don't want you saving money on healthcare. The insurance companies do not want you saving money on healthcare. And your own broker advisor does not want you saving money on healthcare. So no one is going to tell you how to save money on healthcare. And that's not just for the mid-market. That is what caused the CHROs of Caterpillar, of Macy's, of GE, of Verizon. That's what caused these CHROs to even create my organization 10 years ago, is they were like, there is nobody out here who's looking out for us. We've got to look out for each other. And so that is, so do you get pushback? Yes. However, uh, there are great opportunities here. If you, as the executive, the very first, literally the first step that you take, this is what we advise a lot of people. Also, fun fact, if Blackstone is actually really, really good at this, when they buy companies, because they own, a few hundred companies, one of the first things they do after they acquire you is they bring in this crack team from out of New York called Equity Healthcare, and they will come in and work with you as a business owner to teach you how to fix these things so that even a small mid-market company that got picked up by private equity, you can get your house in order with healthcare. And we can talk through a couple of these steps. I'll stop for a second though.
Oh yeah, there's so much to talk about, and I know we could talk for hours and hours and days and weeks, because again, it's something that is out of control. And when you see as an employer saying, oh, I see costs are going up 15, 20, 25% year over year, yeah, that's not sustainable. Right. And then, like you said, then the employer has to make the choice of, okay, I can ration benefits, I can cut benefits, reduce or whatever it ends up being. And so knowing, right, educating people that just because it's always been done this way doesn't mean it needs to continue to be done this way. And so that's where we love to have people like you, right, that are out there and educating people. Hey, you can continue to do that. That's fine. But hey, there is another way. And it's not some crazy, oh, well, is the IRS going to come after us because it's, over the line or close up or any other thing? It's like, no, let's walk through the numbers and show you how it works.
Yeah, no, this is great. Okay, so the first thing we're going to talk about, whatever we're 20 or more minutes into this podcast, if you don't remember, if you're listening as a business owner and you don't remember anything else from this podcast, this is the most important thing. If you take this will be worth 100,000 a year to you. It's a great ROI on the hour you spent here with Matt. If you simply go out to bid for your broker or advisor, this is the first step. is you've got some type of a health insurance broker. They're probably very nice. You might be related to them. I don't know. They probably take you to fun events and they spend a little bit of money on you. That person that person needs to be taken out to bid with ruthless mathematical efficiency. You simply go to the market or send a request out. It can even be as informal as an email to several of the other brokers or consultants in your area and say, we're taking bids for new advisement for our broker or advisor. We'd like to get a bid from you. Second, we would like to explore new and innovative options to better control our cost with self-funding. And in three, we'd like for you to send back proposals and bids for how you would accomplish that. And and references of companies who have had trend at below 10%. A good broker will have multiple. A bad one will be clueless because they just put you with an insurance policy that goes up by 25. And you do those three things. You ask for bids, you say you want to explore new and innovative ways to handle your health insurance that includes self-funding. You need to get off the fully insured policy. If you're stuck on that, like you're totally out of control. You need to move to self-funded. And then third, that you want to be able to receive some of these bids and get some ideas. You take a half day, set up some meetings, and bring in kind of the most compelling folks who responded to your request for bids. If you don't get any really compelling answers, keep going. Look on LinkedIn at people who are posting a lot about these concepts. Look at podcasts that have a lot of great people talking about it. A good one a good podcast, not mine. I'm just friends with the guy, Self-Funded with Spencer. He talks to the mid-market and brings on lots of people who talk about making that transition off fully insured. And if you do that, you will get a handful of people who will come in and blow your mind about ways that you can absolutely save some money. And it is not uncommon to see companies who haven't looked at something like this can save 20 to 40% on this line item, millions and millions of dollars of pure profit while improving their benefits.
It is great again to know that there's people like you out there. Our experience is the same thing. When you show people those numbers on self-funding, it is eye-opening. One, because you said very well-meaning most of the time, brokers or insurance people, right? Generally well-meaning, right? But they might not have the skill set or the knowledge to bring in, right, what they see as, oh, that might be risky, instead of, no, that's an innovative, it's different than the traditional way, but let's actually run the numbers and show you how it works. And like you said, when you show somebody 20 to 40% savings and then that's pure profit, it is extremely eye-opening.
Absolutely. You must do something different. It is scary because you don't understand it, but you cannot continue doing the same thing you've always done. Like, we all know this. We all know this is true. The bull is loose in your china shop, and you have got to take it out. And the only way you can do that is you have to be willing to look at new advisors who are not reinforcing the fear. One of the most powerful tools, and just to be really clear, when you are fully insured versus self-funded, when you are fully insured, you earn 5 times the revenue for the insurance company. 5x. And half of that is pouring into, I don't know if it's half of that, but a huge amount of that is pouring into the pockets of the broker in terms of commissions and trips to Cancun and, tickets to the Masters and stuff like that. That is not what you should be funding. If you move over to where you're paying your own claims up to modest deductible, 30, 40, $50,000. You're getting your data. You're able to now, if your people stay healthy and don't make crazy decisions with the spending of healthcare, and we can talk about that, you hold on to all the savings. So now if you encourage any amount of prudence with your people, you've only got 50, 100, 200 employees, you can communicate good practices out to people. Think of it this way. I had a post that recently went kind of viral. I said, look, I went to work at a healthcare consulting company. And the first day on the job, they handed me a couple of cards. The first one was a green American Express. And they gave me an 11-page single-spaced document that went through and told me exactly how to spend the money. They said, look, you can spend up to $20 at breakfast, you can spend up to $30 at lunch, and you can spend up to $60 at dinner, but all of those added together can't exceed $80. There was a whole like SAT math question about how I could spend the money. They told me where to go to buy my flights, where to go to buy my hotels, what the limits were in different cities. 11-page document, and I had to sign it. That was the first card. Then they handed me my Blue Cross card. They said, you can spend on this unlimited, up to millions of dollars. Knock yourself out. Any advice? Like a pointer? How do I keep myself healthy? I've got skin in this game too. I got a $3,000 deductible. Could you give me a little bit of help? Imagine how much even more I would appreciate all those websites that keep costs of travel low if I had to pay the first $300 myself, right?
Oh yeah.
That's how it is in healthcare. No help, no advice, no counsel, nothing to help me be any way prudent with that card. And the spending is unlimited.
You're like, how do I get the credit card with that, right?
I
Unlimited.
know. Can we swap that?
Yeah.
Give me 11 pages on the health card and then uncork the American Express for me.
Sure.
Yeah.
Lee, question for you. Let's say the business owners out there, they're salivating at the idea of that 40% potential savings that you're talking about.
Sure.
But they got to take the leap, right? They got to put the effort in to go that route and rip the Band-Aid off and get out of their comfort zone. Okay, they've done that. You talk a lot about the health delivery and the experience and the value that exists on the other side for the employees, specifically because so much of the benefit system is broken in that it's not really a lot of great value that exists for employees out there. I want to steer us kind of in the direction of what it looks like from the employee's perspective now. If you go that route to, as the business owner, you're trying to, of course, there's opportunity for massive savings on the balance sheet, but at the same time, if I, the business owner, can also be establishing a tremendous amount of literal and health value to my employees, what does that look like? What does that look like for my organization? How does that work? Talk to me a little bit about this.
Yeah. So everything I learned in this category, I learned from an Uber driver. I'll tell you a little story. On April 18th, 2018, I remember the date. I was doing some consulting for Google up in Menlo Park. And it was my first time going there. So I was kind of fidgeting in the back seat of the Uber on the way in that glorious traffic. And as I was, I was thinking about all that free sushi that I hear they have, and I was hoping they'd give me a tour of some of the facilities, right? So I'm on my way into this meeting, and the Uber driver, her name was Trish. She asked me what I did for a living, and I told her, and she goes, "Oh, I love my health care. In fact, I'll never leave my employer if it means I lose this health care. It's that good." And I dropped everything I was doing. I forgot about the appointment. I leaned forward and I said, "I've never heard anybody say that before. Tell me everything." And she said, "Well, I guess the reason for this is one is I know my doctor and he knows me and he knows my two boys. Second is I know if anything goes wrong, I can go to him and he'll know what to do to help me downstream. So if anything goes wrong, I know exactly where to go. And third, it's super affordable. It costs me $10 to go and see my doctor." And that was it. That was American healthcare for her. If anything goes wrong, she knows where to go. It's affordable and she has trust. She knows it'll be okay. That they know her and she knows them. That is the most powerful benefit any employer can give to their staff.
No doubt. Because again, everybody says we can see all those things, but how does it affect me? Right? That's what everybody always wants to know, whether it's, healthcare benefits, 401k benefits, whatever it is, or, you talk about retirement, all these things. Everybody wants to know that's great in theory, but what does that do for me? What's at stake for me? How does that help me? So to hear her story, yeah, you're like, that's what it should be, right?
Yeah, exactly. I realized I was overpaid in that moment. Like that was like, okay, this is totally logical. Okay. But then it's like, okay, Lee, good story. How do I deliver that? Do I go find a doctor and bring him around to my staff? Like what's the process there? Okay. So that's a valid question. What employers are doing, especially in the mid-market, this is really easy, relatively easy to do mid-market. It's super hard to do at scale. So if you're in 22 states with a bunch of staff members all over, we can talk about that problem separately. There is a solution to that. It's a little trickier. But if you're in, a town or a couple of towns, you've got 50 to 200 people working for you, listen up. It take 30 seconds to do this on Google. Type in direct primary care, just search this area around wherever you're sitting right now, and it'll pull up all the doctors in your area. And you'll see a couple of them that'll say, care direct or primary care direct or direct primary care, things like that, at some of these doctors. A lot of them are independent, some of them are big chains, but it'll start to pull this up in your area. Click on those and take another 10 minutes on your lunch break or whatever and call into a couple of them that are in, a decent location or two, maybe 2 or 3 phone calls, and say, hey, do you do direct primary care? Like, do you have reserved memberships for patients? And these doctors will say yes or no. A lot of, if we misinterpret it, maybe they're just a regular doctor that you can go to with your insurance card. But a lot of them are going to say, no, yeah, we do kind of a reserve system here. And our memberships pay a monthly fee for access. And you say, great. Do you or would you be open to doing a contract with an employer to take care of my staff? And again, you might need 2 or 3 of these to hit kind of the compass points around where you're at, because you've got people living in different areas. That's okay. And find a couple of these doctors, however many you need to handle however many staff you've got. If you've got 50 staff and they're in one area, easy. One doctor takes care of the whole thing. But you find a couple if you need to, and you get them under contract to be responsible for your people. And now when you go to give people their health benefits, you don't lead with, here's a card with infinite spending potential, don't let the door hit you on your way out today. You lead with, at our company, we want to make sure everybody has a doc. And right now, there is a paradox of primary care, and that is the doctors who are taking insurance are not taking new patients. And the doctors who are taking patients are not taking your insurance. But not here. We have made arrangements with a couple of local doctors who are practicing membership model that they take care of our staff. If you work here, you get access to the best doctors in town, and it's same day or next day. And we want you to go and meet the doctors. We want you to have your first visits. We want you to build a relationship of trust and access, so that if anything goes wrong in your home for you or your kids or your spouse, you can call someone right away so that you can be on the job as your full focused self. And then if you get sick, you get better fast and get back fast. That's good business. So it's good for the organization and it's great for your family too.
What employee wouldn't want to know that the company they work for goes to that lengths, right, to care for them, which then, right, because every employer, every business owner is always looking not only for great talent, but talent that will stay and you won't have significant turnover. And all of a sudden you say, I have this benefit versus this company over here. They don't. Guess what? More often than not, people are going to be, again, it comes back to what's in it for me, right? People are going to be like, well, I want that. Give me that.
Everybody wants that. Everybody wants the same doctor too. And that is, they want the good one. They want the good one. And you can give them the good one, because the difference between a good doctor and a bad doctor is, do you trust them and are they available? That
Yeah.
that's really it. There's not a lot of horrible doctors, roaming the streets, with a bottle in a bag and a knife in their hand, right? Like these bad doctors are not out there. These are good good humans. You just need to get to know them and trust them, and they need to be accessible when you're scared.
Yeah.
And if
And like you
you can
said, in
offer
that
that, you
model,
win.
yeah, and in that model, they will have the bandwidth to be able to spend 30, 40 minutes with you, and they will know Lee, right? So when Lee walks in, it's like, it's not, I looked at the chart and what you're Larry. No, no,
No,
it's Lee, right? You know what I mean? It's like,
it's the worst. The clipboard.
yeah,
Oh, it's the worst hazing. That clipboard that they throw at you every time you walk in. Same clipboard every time. They haven't changed it since 1983. Like, oh, it's the worst. So, yeah, the idea is, okay, so as a business owner, I'm not going to start spending 23 hours agonizing between Cigna and Aetna. Forget that. Start with, what's my supply chain? Okay, so I'm going to have we need to find some good doctors to take care of our people, because right now, none of the docs are taking insurance. Right now, the default is your people are fine when they're fine. And then when something goes wrong, they do not know where to go. So they end up just rushing to the local urgent care, who sends them to an ER, whichever one they remember, or happens to be closest to them, or they're on Google Maps while their kid's bleeding and they're like, which ER do I go to? This is Homo sapien. That's what we do. That's what happens to your people. What a disaster. Like, it's a total cluster. So instead, we want to anchor in. We look, if you work here, we want you to have a doctor. We want you to know where to go if something goes wrong. And we want you to be back on your feet, happy, healthy, and your family to be okay quickly. Like, that's just good business. Let's be totally, you can be selfish and you still come to the right answer. Like, hey, I don't even care about people. I just care about what they can do for me. If that, that would be a great clip to take out of context. If even if you're a heartless human and that is what you believe, and that is what you believe, you still want to get your people to have a doctor they know and trust, and who is accessible to them, who answers text messages, who you can video chat if you need to while you're on a road trip and you're feeling, nauseous. Like, that's the doctor that you want every one of your staff to have. And if you do that, that is good for business. It's great for your bottom line. And it's amazing for the family. And so everybody wins, except, the insurance companies. They don't win from that. The hospitals don't, like, big hospital doesn't necessarily win from that, because your people are going to be happier and healthier. And what we see is your use of the emergency room drops by 50%. Use of urgent care, 80 or 90% drop, because these doctors are your urgent care. Your need for, like, mental health crises, drinking, low grade alcoholism, stuff like that, reduces. People start to live healthier because their doctor's encouraging them to make better choices. Your use of the hospital drops by 40% when you have a doctor that you trust. Readmissions and complications at the hospital drops by 30% for people who know and trust a doctor. They have their own doctor. And that is massive competitive advantage for your organization. Your costs will drop more than 20% for every person who sort of grabs one of these chairs while the music is playing. Also, if stuff goes crazy in the next few elections, guess what's going to feel amazing to you as a business owner if there's a huge amount of new legislation, if we get Medicare for all, or any of these other crazy ideas that are out there? That as a business owner would give me a lot of trepidation. Guess what? If you can lock down relationships with doctors, and those doctors have relationships with imaging centers, hospitals, and surgical centers, you don't like, you've already got a chair. It doesn't matter if the music stops. Like, you're good. Your staff are going to be okay, no matter what happens out in the greater economy as well.
Yeah. Well, total sidebar. You said something really amusing. If in the next elections or upcoming elections, there's something crazy happens, well, I think that's a given. So I know we're getting close on time here. So let's fast forward. It's a perfect world, which we know it's not. 10 years, 20 years. How long is it going to take to get that shift, right? And get people to embrace where you get over, instead of just the early adopters, where the masses go, oh, this is the way to go, right? Because you'd said it earlier, there's two things that run the world, and you mentioned one of them: fear and greed, right?
Yep.
Fear is a much bigger motivator, and so you scare those business owners and employers, like, well, why would you do that? And that's right. But can you see where's that tipping point in that next 10 to 20 years? Or is it sooner, or is it later than that, to get that shift over for these businesses?
Yeah, this is going to follow a standard diffusion of innovation curve, which is you've got your sort of leading edge, then you've got your early adopters, then early majority, late majority, and laggards. And that tipping point hits for a new employer somewhere every day. And if families are going bankrupt every day who have insurance because of medical bills. And so I think the lion is out chasing the gazelles, and it's just the slower ones go down each day. This is sort of the way that I see that the system is devouring more and more people and more businesses. So more businesses are waking up. My guess is any business owner who is listening to this podcast right now is probably an earlier adopter. And so, man, take advantage of the competitive advantage right now. As you act and you get 20+% savings, as your costs begin to flatten, as you get data in to see and better manage your suppliers, the doctors, specialists, and clinics and hospitals that are in your area, understanding where the costs are, as you're working to keep your families happy, healthy, and out of a hospital, as you're doing these things, you're going to reap enormous rewards for your business. And you're going to have happier employees. Your turnover is going to reduce. They're going to know that you care, and you're offering a benefit that nobody else is. So for the early adopters comes massive spoils, but that doesn't fix the whole American healthcare system. But as you get those results and hopefully tell your friends, they'll follow the same path. The advisors who help you to accomplish this will start to get more clients. And we talked about the brokers who just golf and collect commissions. They will start to go into receivership. We want those people to be out of business or changing. We need to have demand for the good guys and less demand for those who are asleep at the wheel. But as that shift starts to happen, it'll follow a diffusion curve. And then you're going to have more and more people will jump in. There will be more advisors who are able to help them out. There's going to be more of these doctors who are taking great care of people because demand for their services will go up. Because those who are listening to this podcast, you're going to grab all the good capacity right now. After hearing this, you're going to lock down all the capacity in town for your people, which is what you should do. That's just good business. If there's limited capacity of something that's amazing and most people don't know about it, that is your arbitrage. Pounce on that, because if you don't, somebody else will. And then you're not going to have any doctors to use. You're going to have to wait till somebody graduates med school and opens one up in town. That's not the position you want to be in. So as demand increases, the supply will meet it. And that's where we start to see a change in our whole industry. The hope is that we can get enough people doing that and get that change before something really radical has to happen. my bet is my thought on this is that in the next election or two, we're going to get some weird Medicare Advantage for all or something like that is going to come out. And it's going to create a system of haves and have-nots, just like every other big country. Australia, Germany, France, all the EU, the UK, Canada, they all have single payer. And the difference between good healthcare and bad healthcare is a 3-month wait. If you got the good stuff, you can see a doctor soon. If you've got the state given stuff, you wait 3 months to talk to anybody. That's just how it works. That's single payer. And so if there's a non-zero chance that that's coming in our future, you need to lock down your suppliers now. You need to learn who the doctors are in your town. You can do it on your lunch break. Just go on Google Maps and you can figure out who the doctors are. Make a couple of phone calls. Heck, invite them into your office for lunch. They'd love it. They'd love it. Bring in some Chick-fil-A, call it a day. Have them come in and spend some time with you. Maybe meet some of the people who are right there. They'd love it. And you can invite in multiple doctors at once. They've got limited supply. You want to lock this down. And then you change the way that you're approaching it with your people. Job one is you want every person who works for you to have a relationship of trust with a doctor who's there and ready to take care of them. You do that, you will murder your competition and you will flatten your trend and your people will love you for it. And it doesn't take that much time. It's not that hard. And that's way easier to understand than figuring out what is covered on your policy and which network has a better discount. That's really hard to understand by design, in fact. But just having lunch, bringing in some Chick-fil-A with some local doctors is not hard to understand. And making sure that they're available for your people, anybody can do that, especially a business owner.
Yeah. And again, I love what I love is not only your insight, knowledge, experience, right? But your genuine enthusiasm to change the existing system, right? That is very evident. And so it's like, okay, if you if you ever watch the Broadway musical Hamilton, how do we get this guy in front of a crowd, right? That's the right. That's the thing, right? Which I know that's what you're out there doing, but that's the idea of, hey, is it right for everybody? Maybe, maybe not, but it's like at least understand that there are alternatives to the traditional model.
Mhm. Lee, one more question for you. Another chunk of our audience here are just high-ranking executives, successful individuals that work at Fortune 500 companies or even smaller businesses, but that are high performing. For those individuals out there, let's say if you had, I don't know, 60 seconds in a room with some of those high-ranking folks that are maybe in charge of HR or healthcare benefits or whatnot, and you wanted to shake them and say something to them on a strategy that they could implement for their business, not necessarily sitting at the helm. They've got to pitch this to higher, to leadership, to management, to ownership. Any advice for those folks?
Yeah. It's hard too, because I'll speak to people who are, executives over engineering or manufacturing, and they're like, hey, I want this. And I'm like, do you have any influence in your organization? Because somebody has control of the steering wheel and it may be 3 people over. So you work out the influence. We're going to assume though that you do have some influence directly over to whoever is in benefits or HR who's running the health plan. Uh, or let's assume that you are the CHRO or the VP of total rewards or something like that, and you want to make a difference. The first thing you need to do is just have a vision and believe like, hey, it is absolutely possible to flatten your trend without hurting people. That is absolutely possible. It's there for the taking. And it's likely worth hundreds of millions of dollars to your organization, and at least in terms of equity by improving your profit margin. So the reward is there and the opportunity is there. And if you believe it, that is the first step. So, okay, Lee, I believe it, whatever. I believe what you're saying. So now what do I do to capture it? So step 2 is you need to say to your team, hey, we need to get our trend down to we need to cut our trend in half. We need to get to low single digit trend for our healthcare costs. It can be done. And we know that we have to do things differently to get there. That's the other thing, is you need to understand that you can't do the same crap that you've been doing. You have to do something new. So embrace that. So now we've got a vision, we believe it, and we've told our team who's in charge of it that this is what we need to achieve, and we have to do something different, because a lot of teams, even some of those who work with me, they'll come in clutching their pearls saying, "Oh my gosh, we've got to get our trend down." And I'm like, "Okay, we got to do some different stuff." And they're like, "No, no, no, we don't want to do anything different." And it's like, well, tough. You can't have both, pal. You gotta embrace doing something different. Okay, so then step 3 is you've now got to get advice and help to get there. Most of that advice can actually be found for free on podcasts, right? Hundreds of millions of dollars. You can listen to mine. You can listen to the Relentless Health Value podcast. You can listen to Self-Funded with Spencer. Those are like 3 really good ones that will give you advice. And some cater to larger companies and some to smaller. And they'll give you that advice for free. And you get a new advisor, a new consultant or broker. The one you've got right now, if you're getting bad results, you got the wrong broker. I'm sorry, that's just how it is. If you don't like the results you have, the wrong person's giving you advice. Or you got the right person giving you advice and you're not following it. So that's how you diagnose a busted result. Real simple. Are we the wrong people, or do we have the wrong people advising us? And if you're the right people, you need to get that person out of there. You need to swap them out. And I know they're your friend. Let them come mow your lawn instead. I don't know, but you can't have them advising you on your healthcare. And then when you get in the new advisor, everybody's aligned that we've got to get our costs under control. We got to get that advisor off commissions, pay them on fee for service, and pay them a bonus if they help you get your costs below 5% without cost shifting onto your families. And those are the first 3 steps. You do those 3 things, you get a vision, you tell your team, this is the mandate, and then you swap out somebody, whoever's giving you advice that got you where you're at, get rid of those people and get somebody new in who's going to help you do it. And if they fail, get rid of them too and get a new one. You're going to be in good shape.
This has been fantastic, and we have taken way too much of your time, so we really appreciate it. Love the conversation. Love the conversation.
Yeah, no, this is what I do. This is what I love. If anybody listening to this has questions, thoughts, or issues, find me on LinkedIn. It's super easy to do that. Like I should be 1 or 2 degrees from you wherever you're at, and am eager to help anybody to do this. The more employers we can get taking the right common sense business steps, the faster we can actually change our system. Because guess what? I don't want our system to be broken. We need to catch up at least to like the EU, where they get 6 years longer life expectancy at half the cost. And if we're really good, we can catch all the Asian countries that are like head of the class, Singapore, Japan, South Korea, Hong Kong. They're 80% lower cost than the United States with 6 more years of life expectancy. And they smoke a lot more than we do. Like there's no reason that we shouldn't be able to get there.
Alrighty, folks, there you have it. Lee Lewis, Chief Strategy Officer over at the Health Transformation Alliance. And I always use the word firecracker to describe Lee. He's so passionate about what he does. Matt, I mean, he threw a lot at us. And for our business owner audience, what were some of your big takeaways?
You said it. He has a lot of energy, which again, it's that passion that he has for what he does, and he knows what he's talking about. Again, right now, is this right for everybody? That, time will tell, but we all would agree that something needs to change, and know that there are alternatives that are out there that are not some crazy thing that is untested, right? Or is going to get somebody into trouble if they go down this path. And in fact, it could potentially be significantly better for your employees, right? As the business owner who cares, which most do. Like he said, hey, maybe you have some who are like, I don't care, but really, right? Most care, right? They got into it for a reason, they hire people for a reason, and they want to take care of them. And this is a way that you can elevate a benefit for them, as opposed to, like he said, hey, here's this card, good luck with it, spend whatever you want on it.
Right. I also love that he shares, like, everybody loves a win-win, right? But there's actually a win-win-win opportunity here between lower costs and either keep value of the healthcare benefits services that are given the same, or dare I say better, while also adding that savings of costs to your bottom line and putting money back into the company. There's a real opportunity here. And the other thing that also is great to hear Lee share is it's not like you as a business owner have to sit around and wait for the greater healthcare landscape to change before you make a decision to do something. Like, no, you can do something right now. It's as simple as lunch with Chick-fil-A, as Lee put it.
Yeah.
But no, it's great that there's options and there's actually action you can be taking right now to address this issue, and you will reap the rewards. It just takes some boots to the ground work to be able to pull it off.
Yes. And we know as business owners, right? Time is the thing you're trying to, slow down, because there's so many things with your business, you're doing this and you're trying to reach the goals and meet the targets and all the things, right? And so, but when you look at this, if it's going to improve the benefits and lives of your employees, that's going to improve your bottom line. Just, we know studies show that when people are more bought in, they will go the extra length for the company. And then when you say, hey, we have, like in his instance, hey, you work here, here's the doctor or two doctors. They will know Ryan, they will know his family, right? So when you need something, you call. It's not you're waiting in line. And, personal story, like I needed to make an appointment and it was early in the month and they said, we can see you at the end of the month. It's like, I literally did not have time for that, right? Like, because it can be a life and death situation.
Yeah. Yeah. And having the relationship, it's worth its weight in gold. Just going to it's like a trusted advisor. We talk about that all the time on this show. Like that's really what it is. There's advisors for your wealth, your insurance, your legal side. There very well should be one for your health side. And this is an option to be able to do that for not just yourself as a business owner, but the employees that are your greatest asset for a company. So, just a lot of great stuff with Lee. If you made it this far into our episode, this is a no-brainer. You should absolutely check out Lee's podcast, Broken Benefits. I mean, he has some phenomenal conversations going deep into the weeds of the strategies that you can implement regardless of the size of business. Just a lot of good stuff over there. But to our audience, I really hope that today was a good one that you could take away some value from, just to think differently about something you're probably not even thinking is a savings opportunity, but also a value add opportunity for your business. But Matt, for anybody out there who's interested in having deeper conversations with you, Scott, and the team, whether it be healthcare related inquisition or strategy, or not, anything around their financial world, what's the best way somebody could reach out to you guys?
A great question. I'm going to add on to what you had said. Hey, you can contact us and we can walk through stuff and connect you with Lee or someone like Lee, right? Again, it's how can you improve the situation for your business and your employees? So for us, the traditional way, phone 517-333-7967, or go to our website, Morrison Nordmann. My name is 2 N's on the end, nordmann.com, and look around there. And if you want, you can request a call right on the website.
And speaking of the website, it's looking really good these days. I know you guys did a revamp. It's looking good.
Appreciate it.
Yeah, of course. Well, look, Matt, I appreciate your time. I will see you back here on the next one. As always, we'll let Scott kick his feet back. He deserves some relaxation. But for the audience out there, we appreciate you guys carving some time out of your day to allow us into it. If you enjoyed today's conversation, if you learned a thing or two, I know I did, make sure you hit the subscribe button on either of the platforms that you listened or watched on today. You'll learn a lot more as we continue to bring some great guests to you. And that's ultimately our goal at the end of the day, is to provide value and put you on that path to abundant living. But for Matt, I'm Ryan. We're going to go ahead and say so long, but we appreciate each and every one of you stopping by today. Have a great one.